Health research has high value to society. It provides important information about disease trends and risk factors, outcomes of treatment or public health interventions, functional abilities, patterns of care and healthcare costs and uses. In the Kingdom of Eswatini, the Health Research Training Program is a capacity-building initiative for in-service healthcare workers. The program has been implemented by the Ministry of Health with technical support from ICAP at Columbia University through CDC and PEPFAR.
The ministry saw the need to engage in a very innovative way to build capacity towards health research. And we appreciated the support through PEPFAR and ICAP, the implementing partner. And we started the Health Research Training Program within the ministry.
The program has run for 5 years and enrolled 5 cohorts totaling 40 fellows. Each year, fellows and mentors submit their applications. Candidates are then shortlisted using a score provided by 2 independent reviewers. And finalists are selected by the Health Research Training Program Advisory Board.
There's been objectivity and transparency, first of all, in the selection process. The application is de-identified to eliminate bias, and then it is independently reviewed by the different entities, and a score is assigned and then later computed so that only deserving fellows are selected into the program.
The goal is to empower healthcare workers with the skills and knowledge to conduct and utilize health research.
Health professionals in Eswatini have a long track record of engaging in international research. And the HRTP program has given these health professionals the skill set needed to be fully engaged as co-investigators. Additionally, it has allowed these health professionals to generate their own research questions that are important and do the research needed to get the answers that are applicable in the Eswatini context. And that's important because the success of the health programs here are dependent on data for decision making.
How is the training conducted, you might ask?
They learn throughout the year in a very structured way of modules and a very practical way of conducting health research.
ICAP Swaziland were best suited to implement this program, as they have the expertise and experience.
One of the pillars of ICAP program, wherever we work, is to work closely with the Ministry of Health to build the capacity of health workers in terms of research to allow generating evidence for programming and policy development.
What are the thoughts of the fellows who took part in the Health Research Training Program?
I'm happy to say I can be able to even implement what they taught me at HRTP because of the way they were teaching us. It was more simple and we were able to grasp each and every concept that was being said.
HRTP was actually a nice program. It was interesting. However, I did discover that HRTP was no child's play. It was a rigorous and a strenuous exercise. It required so much time, so much dedication, and tenacity in doing certain things.
It's more practical, it's more hands-on, it's a move from concepts to practice routinely and moving forward. The experience that has been that I've got from the health research training program has been so helpful for me.
I liked the mentorship program because we're trained and mentored by experienced people that are well published and people that are quite rich with knowledge and information.
So the nice thing about it is that with the lessons that I learned, I'm actually now incorporating them in my teaching.
In the health sector and also in the other ministries, research is a buzzword these days. The HRTP program is really going to help the country in the sense that it's building a wider pool of the research capacity in the country and people who can question things to inform the interventions going forward.
I remember having a conversation with my country director, and he was looking at where we started, and he really appreciated actually the experience that I'm now bringing, and he attributed that to the HRTP program.
In my academic era, it actually also helped me to want to learn more, because at that time when I started my HRTP, I was actually doing my master's, but I'm currently doing my PhD, and it's also adding to what of the basics that I've learned in terms of research.
How did the mentorship assist the fellows?
What the program aims to achieve is to actually achieve a skill transfer. So we have a variety of mentors, and I'm one of them, with different backgrounds, some coming from the health sciences, social sciences, biological sciences as well. So we tap from the different skills to ensure that we are able to transfer skills to the fellows. So basically it has strengthened in terms of making sure that the fellows are able to be supervised adequately in terms of developing their research protocols, also be able to do data analysis, but also all the modules which are involved in the program.
The Health Research Training Program is already bearing fruit.
Some fellows have even gone to the extent of publishing their work. Some of them have presented in international conferences. Some of them have even, participated in development of guidelines where they've been required to offer scientific evidence.
What impact will the Health Research Training Program have on the ordinary man on the street?
The patients and clients are the people that is always at the forefront of our programming and our any development in health. We think of what we need to provide for. So there isn't anything as good as services packaged to meet the needs of the client. And we can only get the accurate need of the client through research, so that we meet them where they need the health services. So we can relate that. We are improving on it. Over the 5 years of the training program, we have better programmers who use research-based, evidence-based information to sharpen and strengthen our service delivery models. We were able to tap on ICAP's rich experience in health research, and the attachment to Columbia University makes us be able to tap on that wider academic resource that is within in the ICAP in New York, and the experts that come into the country. So that's how effective this has been, and that's why we are positive that it's in the correct direction towards making this country the first world country within the health field.